Hi everybody, this is Dr. Hassan Al-Lawati. Today I'll be talking about a definition of osteoporosis, and then I will briefly talk about when you will consider treating patient based on T-score and bone density. Now let's start talking about the WHO definition of osteoporosis based on bone density. Now, most of you know that we rely on T-score. If the T-score range was -1 and above, then we will define it as a normal bone density. If it is between -1 and -2.5, then we will define it as osteopenia. And if it is between -2.5 and below, then we will define it as osteoporosis. Now, when we will consider drug treatment, now always we need to encourage the patient to take calcium and vitamin D and encourage them for lifestyle modification. That's applied to all patients who are diagnosed with osteoporosis or osteopenia. The question is when you will consider drug treatment. And when we say drug treatment, we are talking about osteoporosis therapy. For example, bisphosphonate, denosumab, and other modalities of treatment, which we're going to talk about it later on. So the rule says any patient defined as having osteoporosis, you need to start drug treatment. The controversy comes when the patient is in osteopenia range. So if the patient is osteopenic with history of fracture, then you need to consider drug treatment. But if patient is not giving a history of fracture, then you can use what we call FRAX score. Now, what is FRAX score? FRAX score is a score which tells us the 10-year risk of fracture. Now, if the major fracture risk was less than 20% or hip fracture risk was less than 3%, then you just keep the patient on calcium and vitamin D with bone healthy lifestyle. But if the major fracture risk was more than 20% or hip fracture risk was more than 3%, then here you should consider drug treatment along with calcium and vitamin D. So that was a brief talk about osteoporosis and osteopenia and when you will consider drug treatment. If you have any comment, please write them below. Thank you.